Hi everybody. I just wanted to get on here because I just wanted to share my point of view as a special needs mom and a caregiver and a patient and a mother of a patient, and just our point of view. As so many of you know, both my kids have special needs, and they're both pretty significant, completely different diagnosis. They are both mine. I've been asked if they're adopted many times, and they are both mine by birth. And we are just going through a really difficult time with Luke this summer. Luke has been diagnosed with a really rare autoimmune condition about 2 years ago, I want to say. And I know that he had an autoimmune condition when he was about 8. And the reason I wanted to just share my point of view is because I want to talk about something I'm really passionate about, and that's trauma and PTSD, and also chronic PTSD. I wanted to talk about it because I don't think people realize what special needs families go through, and just where we're at mentally, and what we're expected to continue to do, and what just our life requires of us. And a lot of times we didn't choose this life, and I think it's just really important to remember that. But love is very powerful. And so I wanted to get on here, and I just want to talk really quickly about PTSD as a result of the medical community interaction that we've experienced. And I know that countless hundreds and thousands of parents have gone through with the medical community. And I want to kind of, preface this saying that there are good providers out there. There are phenomenal doctors who we would not have got through this without. There are phenomenal nurses. There are phenomenal techs and phlebotomists, and we've just had some really wonderful experiences. But we've had really, really bad experiences. And my son had an autoimmune condition. Like I said, I knew when he was about 8 years old, and I was doing some research, and I went in and I saw a doctor, our pediatrician at the time. She was amazing. She also had another special needs child, or she had a special needs child of her own. And I said, this is what I think he might have. I don't know, but, what do you think? And she was like, well, the treatment, to kind of let us know where he's at, or, if this is true, is pretty simple. And so we did it, and Luke went completely back to himself. Now, obviously, this didn't take away his autism. Luke still had autism. So we were like, wow, okay, this kind of confirms that maybe this is something he has going on. And just keep in mind, I already had medical trauma from Luke and Maddie when Luke was younger. Luke definitely was vaccine injured. And I no longer care that it's controversial, because evidence-based testing and studies at this point, I feel like, are not honest anymore. I feel like I think that the motivation behind many of them is not pure. And I think science was and used to be pure, but I think that it's changed a lot. And so, and the only reason is because I've seen firsthand, I've seen evidence that was so glaringly obvious. I've seen studies that are so obvious, and I've seen, depending on where people sat on the issue, what their opinion was about it, I've seen them disregard and evidence, and completely unwilling to even read peer-reviewed evidence-based research studies. It's unreal to me how bad this can be. So I'm sharing because Luke is struggling again, and we're back in this place where I haven't been for years, where I've had to, what has been working for him treatment-wise has been working for a few, 4-5 years, I want to say. last time I've had to fly to University of Arizona and see other hospitals. Stanford also treats this condition, but they no longer take out-of-state patients. And we've gone to Seattle Children's, and this story is a common story, though. This is a story that so many special needs parents tell. And don't get me wrong, like, I don't want anything to be wrong with my son. I didn't look for it, but my son changed, and the consequences were things I had to deal with, and no one was helping us with that. The doctors, the way that they could help is to be thorough and look into treatments and be willing to try treatments, because, they're willing to try treatments that they want to try. They're unwilling to try, and they're treatments that work, but it's kind of an ego trip. It's just a really big pride issue. And what my whole point of getting on here and just sharing my point of view is that so much trauma has been caused in our family, in my mental health, my body, my son, my husband, my other child, my other son, my family. We have all endured the consequences, and I'm just over it. And I haven't decided what I'm going to do yet, but something has got to change. And I think this is part of my calling, and it's just so interesting to have. It's like an abusive relationship. That's the only way I can describe it. When you have a spouse that acts crazy or demeans you or is abusive or verbally abusive, and then they act normal around other people, or when they're when you try to communicate how they've treated you and how hurt you are and what needs to change, and you call them out on something they were incorrect about, or something that you disagree about, but that really there's no right or wrong, so it's okay if they were to do what I wanted to do. The manipulation that happens, and the demeaning and the disrespect and the disregard is just, it's abusive. And I think that, we live in this time where people just really kind of minimize trauma, and so many people say, I was traumatized. My husband and I have seen things that have traumatized us. It's like being in the medical field, and I don't know how people in the medical field, actually, I'm sure tons of them have PTSD. The things that we've seen, the things that we've had to deal with, the psychotic breakdowns that our son has had, and the physical attacking, and the just out of nowhere, and we've been dealing with this since he was 8. And on top of it, not being listened to multiple times when our kids were in critical situations, and it costing big time. My children being further harmed because I was not listened to, my instincts and my knowledge. Just because I don't have a degree doesn't mean I'm stupid. I do have knowledge, and I've gained a lot of knowledge, and that knowledge has changed the trajectory of my children's lives. Had I put my children completely 100% in the lives of medical professionals, they'd be dead. 100%. There are multiple occasions where my children were in a crisis situation and they didn't believe me, and we either had to get another doctor, or my husband took them in, and he didn't advocate, because he's like so many people. A doctor is a doctor. It's like they're an authority or something, and they're not. It's a person. They have no authority over you. Now, they can do things to make your life hell, unfortunately, because there's no checks and balances. But my husband and so many other people don't realize that you can advocate for yourself. You can deny treatment. You can advocate and ask for another treatment. You can ask for another physician. You can report them. You can file a formal grievance. You can file a lawsuit. There are so many things that you can do to hold the line for you or your child or your spouse or someone you love. And people don't realize that. And it's the same with insurance. People don't realize that when the insurance company says no, they're stupid. They're doing it for a profit. They're doing it for gain. And you just have to get the right documentation in, because they can't deny something that's medically necessary. They do a lot, but most of the time, given the right documentation and enough fight, so you can probably 75% of the time get things taken care of. Sometimes you can't. But I'm just sharing this point of view because I think it's really important to know that there is abuse happening in the medical community all the time. I have had my husband, me, my children, I've had physicians in the ER walk in with a chip on their shoulder, with a nasty attitude for no reason, unapologetic, unwilling to be a team player, and it's cost pain and suffering for my children, for me, for my husband. And that's happened in several situations. I can name them, but I won't right now. But I just want to share this because PTSD is such a legitimate thing for special needs families. It is a huge deal. It's a huge factor in everything we do. We can't trust very many people, because I personally have been proven that I cannot trust very many physicians, very many nurses, very many techs, because they've caused harm to my kids. So I have to go in with my guard up. I have to be discerning. I have to have wisdom. I have to get a feel for the situation. And then that trust is built. It's like any relationship. It's the weirdest thing that the medical community demands right off the bat, that we should just automatically trust them. That's a lie. You don't need to believe that. I'm not saying that we need to be paranoid, but I'm saying it's our job to be wise. It's our job to use the God-given brain that we have, and it's our job to use our instincts. It is, in God's eyes, all equal. People are all equal and all accountable for the same things. And that doctor with letters behind their name, they're not better than you. And that is what I think keeps coming across. And I'm done with it. And I'm done being pushed around. I'm done having my kids suffer at their hands. But I think the thing is that with any pushback comes consequences. And there is always some way, I feel like, not always, I'd say a lot of times there's always some way that if I give any pushback, there's some kind of consequence that I'm going to suffer. If I'm like, I would prefer you looked into this treatment. I would rather not do this treatment. I'd rather do a different treatment. Please draw these labs. Why haven't you checked this imaging? I'm not ready to try this medication when you haven't, checked this other medication. Or, why haven't you read the research that I've provided you with, or this study? Can we talk about this? Can we have a discussion on this? Why are you unwilling to learn? Why are you arguing with me? I mean, there's just so many things where it's like, it doesn't have to be their way or the highway. That's completely inappropriate. And you need to find a new doctor, a new nurse, a new tech. And it's just interesting because we have this mindset that we call people that, expect something different a Karen. And I know I've seen them, and I've seen videos, and that's not what I'm saying. But I think it's ridiculous that we're expected to just take what we get and be grateful for it. When it's poor care, when people are being abusive, when people are, complete and utter jerks and hurtful and assholes. And it's called, they just have bad bedside manner. I wouldn't be able to talk to people like that in public, or someone I was doing business with, and get away with it and not lose the job or not lose the contract or whatever. It's just unreal to me. So